So I would like to invite Dr. Vasyl Strelka from Ministry of Health of Ukraine, Dr. Mark MIMS from Operation Ukraine at OU Health, Dr. Nelia Melnichuk from GMKA Hill Ukraine Group, Dr. Michelle Gladunevich from Sunnybrook Health Science Center, University of Toronto, and for Andriy Zinchuk, there is a representative, Yevhen, please join us, from Doctors United for Ukraine, Yale Medicine. Thank you so much for joining. So here you could see the amazing people, volunteers dedicating their time, efforts to build capacity, healthcare capacity in Ukraine with educational programs, research programs. You heard already from some of the speakers, and I would like to give an opportunity to Yevhen, maybe describe his program from Doctors United from Ukraine.
Yes, absolutely. Hi, my name is Evgeny Meyer. I'm an attending psychiatrist from Yale University. I'm also a member of Doctors United for Ukraine. And this year we had our third installation of our SARU program, the Scholars at Risk, where we brought in 8 physicians to visit us for an integrated pain and mental health observership. And there was also a high-risk pregnancy component to it. So we had 2 OBGYNs, 4 anesthesiologists, and 2 psychiatrists. And this was generously funded by the Yale and the World Scholarship Fund, a grant that we applied to. So we had good institutional support as well as a partnership that we developed with Nova Ukraine. So it's a month-long program, 4 weeks. It is an observership. There isn't that much hands-on, as I've learned. That is a possibility that I think we'll work to build in the future. But it was a spectacular program. Everyone came out very satisfied, and we maintain context with our scholars from previous years as well. And we look forward to continuing this tradition annually and perhaps more frequently, and now inspired by all the ideas that we've heard today. So thank you.
Excellent. Thank you so much. Next question would be to Dr. Vasyl Strelka. You've heard various examples from all of the speakers here on the panel of the observerships they organized, educational activities they organized. What's actually needed from the Ministry of Health? What do you see it as success? We define success a certain way in evaluating these observerships, but what's the success from your standpoint?
Really, we saw success, and if you talk about some different cases, for example, I can give some examples. It's training in MGH. It was organized by Serhiy Melnichuk at returning back to Ukraine. The teams already performed, for example, lung transplant without any support from other colleagues. As examples, it was training organized by Peace and Development Foundation.
Yes.
Rostislav Semikov in Vanderbilt, the transplantologist from Vanderbilt, shared with our team technology, which give us a longer time for preserving organs. This was like game-changing technology because we cannot use helicopters for transporting organs, and we should transport patient and equipment in small hospitals. And after performing heart transplant, we get the patient back in the transplant center, for example, in Kyiv. After this technology, we know we can transport a heart during 5 hours, for example, and this cover all Ukraine. And we have other different cases, but if we talk, we are interested in a sustainable system.
Right.
And we ask for choose some hospitals with teams which are already very skillful and already train other their colleagues in Ukraine and establish like center of excellence. We have the similar approach in rehabilitation. We choose the 7 hospitals. We ask them about their educational needs. We give us the list of their needs. We went around the world and looking for where we can train them. After this, these teams train all teams from different hospitals in Ukraine, and we can move in such way in different specialties, establish center of excellence, because we were interested that even wars will stop, and this huge support which we have now already will stop. We were interested in sustainable system.
Yeah, thank you so much. How can the Ministry of Health support us? You know, our organizations, our volunteering. The most support that I think we would need is visas and help with border crossing, especially for male drug
We
leaders.
can wrote a signed support letter for our border service for border crossing.
Yeah, excellent. That would be very, very helpful. Thank you so much, Vasil. Nelia, you've done an amazing amount of work with the GMKA and HUG. What are the major lessons learned? Maybe bullet points, rapid.
Oh, wow. I think the major lessons learned is that we have to have structure to the observership. We have to select people well, people who will definitely bring that knowledge in Ukraine, and actually try to put some rules around that, because you know, sometimes it's a lot of effort that goes into organizing observership, not only financial effort, but also paperwork and just personal capital that we have here, because it's all people who trust us. So we will bring good people from Ukraine to be able to do good work. And everybody is doing this work obviously for free, taking time from their families.
Definitely.
So we have to make sure that we choose people well. Hopefully that they will definitely, like one of our rules coming here is to definitely bring something back, and we follow up on that. We see that they do presentations, do they do teachings. That's actually how we select people to come here. But another thing that's important, and we have not figured out the best way to do that, but I think it was echoed in all of the presentations, people who go back to Ukraine still need support from us. It's nice that they came here and learned something, but it's very hard sometimes to implement it in Ukraine, because sometimes it's an old Soviet bureaucratic system that they go back to, and without encouragement, without continued support, things don't change. For example, we have Inessa Huivanyuk, who was one of our first fellows, and she's implementing quality and safety in programs in Ukraine. She also came to Canada with Michelle and formed very good relationships there. But just because the system is so hard to work and it's hard for her to move the needle and to push the quality and safety in Ukraine. So support from here needs to continue for all the fellows who came here. So when we are bringing people here, we have to think of how we are going to support them moving back home, forming those mentorship teams, a little bit more in that regard. And so that would be kind of the main things that I would suggest we all focus on.
Yeah, thank you.
But also between us, and actually what happened was UAMED, collaborating between us, because we also noted that sometimes all different organizations would bring the same people over.
Yes, that's true.
And it became a little bit of a medical tourism, right? And we don't want to participate in that. Like if we are going to spend our time doing this, we want this to be impactful. So for example, just recently we actually coordinated very well with Yale, where your pain team took a course at Harvard remotely that we were able to, because of Jackie, we were able to organize for less money, and we actually contributed, and then they came in person to Yale and learned those techniques. I think this kind of model is really, really good, and we should work closer together, that we collaborate. And then some institutions are stronger in one thing, and some institutions are stronger in another thing. So if we are bringing people to the United States or Canada, let's kind of figure out, maybe we do kind of broader fellowships or observerships.
Yeah, excellent. And that would be leading to my final question, maybe to Michelle and Mark, since you kind of did the rapid fire at Canada, US. How for us would be possible to collaborate and join our forces, maybe Canada, US? How can we do this?
I think I think it's mandatory. I think, you know, I'm very happy to be here to see how much is going on,
Right.
but a lot of what we're doing here is still going on a little bit in silos too. Like, we've got a program, you've got a program. The need, we can all have programs because the need is tremendous, but organizing between our programs would be very rational. You know, it does feel a little bit like, you know, whack-a-mole. You know, you get somebody, you do one thing, but the needs there are just so great because of what Nelia is discussing, is the actual system that they're working in just needs so much support. So I think there does need to be a bit more of a structured approach. Like it is one thing to teach surgery, but then if you teach surgery and you don't have infection control, and they get infected, then you've kind of not necessarily advanced it as much. So I think it's a system that needs a lot of our attention and our help to help them develop a system. Like I see these really talented, exquisite doctors, and they really are, and lovely nurses, but then they don't quite have the same resource and system that we have, that we just take for granted, actually. So, you know, I think it's finding, you know, the hospitals in Ukraine that want to start to evolve into like having a more systems approach and a collaborative approach. You know, like they don't have a lot of infectious disease doctors in Ukraine. Like they actually, it's not even sort of a specialty in itself, right? And like Dr. Moreau said, like it's not for him, or in Canada, we wouldn't think about treating the infections. We would call our colleagues.
Right.
So if we could help them develop that, you know, where people work together, I think that would be great.
Yeah,
But I
excellent.
do think we need to be doing more of the things we're doing together and like.
Right. So maybe developing like a hub, right?
Yep.
That we all partner in, and then we discuss
Exactly.
our program strengths, weaknesses, what can we improve, how can we collaborate better. Mark, what do you think?
Yeah, I would echo everything that you said. I think that the collaboration is necessary, and I think that the concept of UA Med and this conference and places like this where you get the right people to the room that can talk and then kind of collaborate from there. So to your point, you know, why don't we just have a repository, a single application for all interested observers from Ukraine that we can then disperse to the various organizations that have those strengths in those areas. And so things like that are definitely probably the next step. But these meetings where we can all get together and meet each other face to face and hear what we're all doing is how that's going to happen.
Yeah, excellent. Thank you so much to our great panelists for a nice discussion.